Good afternoon. Happy Saturday, all. Wanted to talk to you for a few minutes today about when your hands go numb, whether or if you get pain in your hands, pain in your wrists. Most commonly, people associate that with carpal tunnel syndrome. So, wanted to first differentiate briefly these three fingers, carpal tunnel. These three fingers aren't related to your wrist necessarily in most cases, but couple of things. Most people when they're treating carpal tunnel syndrome or numbness in their hands, they blame their repetitive use at their job, whether they work on a computer or whether they like grab a gun consistently or something like that. But carpal tunnel syndrome, or having your hands go numb, has quite a few other possibilities. So first of all, it's most commonly treated with splinting, possibly physical therapy. If it gets bad enough and the scar tissue on the wrist gets bad enough, people will often have surgery, with, I would say, mixed reviews or mixed levels of success. So what I'd like to share with you today is a much more conservative, much lower risk, in most cases much lower cost alternative, which is chiropractic care for it. So why do I talk about that? First of all the doctors in our clinic have additional training for treating the hands, wrists, and fingers. So if you actually do have true carpal tunnel syndrome where there's impingement in the carpal bones or the wrist bones, we have doctors that are trained in treating that. So one of the reasons for that is the three bones in your wrist make three C's. So they make three C's right in a row. And what can happen is that middle one can get hitched or kinked down because people cock their hands when they push or when they type or whatever it might be. And so our doctors are specifically trained to set the wrist. Additionally, if you think about how many people look down or have forward head posture, people's hands going numb can also be in their elbow. It can be impingement here. It can be in their shoulder. And actually what we find is most commonly it can be impingement or nerve issues in the neck. So what I love about that is if you actually get to the root cause of the problem, you're going to get a much long-term success, or a much more long-term success. And additionally, what I think is so cool is it is so conservative. There's very, very, very little downside, and it could possibly help you avoid surgery or dangerous side effects of certain medications. So consider getting to the cause, look at the neck, look at the shoulder, the elbow, and the wrist, and have somebody who's specifically trained in conservative treatment take a good look to help you live a better life. Have a great day.